Does obesity increase your risk of kidney stones? Is your weight raising your risk of painful kidney stones? As a urologist practicing in Birmingham, one of the most concerning health trends I've observed is the continuing rise in obesity rates across the UK, the health complications associated with obesity. Diabetes, heart disease, cancer are well established. However, patients are often surprised to learn that carrying excess weight increases their risk of developing painful kidney stones. I'll explain how obesity creates an environment in the body that promotes kidney stone formation. Based on insights from my medical training and years of treating patients, I'll also provide practical tips to lose excess weight and lower your chances of suffering from these excruciating pebbles in your kidneys. How obesity causes metabolic changes that lead to stones. My urology training and ongoing medical education taught me how being significantly overweight triggers a cascade of metabolic effects that can impact kidney function. Excess body fat, especially around the abdomen, causes changes like increased insulin resistance, which alters kidney handling of chemicals that form stones. Higher excretion of calcium, oxalate, and uric acid in urine, critical ingredients in most kidney stones. Imbalances in levels of stone-promoting chemicals like cysteine. More acidic urine. The heavier you are, the higher your kidney stone risk. Studies I review to stay updated consistently show a correlation between higher body mass index, BMI, and greater incidence of kidney stones. This altered metabolic environment makes it easier for stones to develop and grow. For example, the most obese with a BMI over 35 have a two-fold higher lifetime risk of kidney stones than normal weight individuals. 30 to 50% increased risk compared to just overweight, not obese, patients. I don't need to watch BBC Midlands Today to see that Warwickshire and the Midlands have an obesity problem. The hospital data shows me that the more excess weight you carry, the higher your chances of painful renal stones. Even losing a modest amount of weight can make a difference. Specific stone types are linked to obesity. In treating Birmingham patients, I've observed that obesity seems to predispose certain stone types. Uric acid stones are 2 to 3 times more common in obese patients. These form when urine is persistently acidic. Cysteine stones are more prevalent, as obesity alters cysteine handling. Struvite stones are also associated with obesity, partly due to diabetes, which changes chemical balances. So, obesity creates an environment favoring some of the most difficult to treat stone types. Effective ways to lose weight and lower your risk. The good news is that losing excess body fat can significantly lower your chances of developing painful kidney stones. I advise my overweight patients to reduce portion sizes, especially of calorie-dense foods. Limit sugary drinks, packaged snacks, and desserts. Fill up on vegetables, fruits, and whole grains. Choose lean protein like fish, eggs, beans, and chicken. Avoid high salt and fat takeaway and processed foods. Incorporate regular cardio and strength training exercises. Enlist professional support from a nutritionist or doctor if your BMI is very high. Can you still have Yorkshire pudding with your Christmas dinner? That's up to you. However, a good portion of a homemade Sunday roast or Christmas dinner can be healthy. Custard and pudding maybe not. A walk before or after would help. You can lose excess weight and avoid obesity-related kidney stones with persistence and incremental changes. Drink more water and know the importance of hydration for the kidneys. My advice as an experienced urologist. As a specialist who has treated too many kidney stone cases in overweight Birmingham patients, I hope this article brings awareness to the clear link between obesity and increased risk for painful renal stones. The metabolic changes accompanying excess weight create the perfect storm for certain stone types. The good news is losing even a few pounds can make a big difference in lowering your risk and avoiding this agonizing recurrent condition. I encourage you to speak with your GP and take steps towards a healthier weight. Your kidneys will thank you. Mr. Haider Syed, Senior Consultant Urological Surgeon. Graduated as a doctor in 1984 and have been working in the NHS for over 30 years. I started my urology career in 1991 and completed training at the John Radcliffe and Churchill Hospital, Oxford, in 2000.